Hello, everyone, and welcome to today's webinar, Decoding Health and Safety Success. My name is Anna Rowinska, and I am your technical host. Thank you for joining us. To adjust your audio settings, please click the microphone at the bottom left of your screen. Then click the up arrow to select various audio controls. Although your microphone is muted, you can ask questions at any time using the Q&A icon at the bottom of the screen. Please use the comment section as well to chat with other attendees, share your thoughts, and let us know where you're from. Our presenter will respond to as many questions as he can during today's session. Our moderator today is Wayne Arandas, COO of the Manufacturing Safety Alliance of BC. Welcome, Wayne.
Thanks, Anna, and welcome everyone. I feel privileged to be joining you from the Fraser Valley office of the Manufacturing Safety Alliance of BC in the Chilliwack on the traditional unceded territories of the Stolo Coast Salish people. I'm grateful for the opportunity to speak from these shared lands today. A little bit about the Alliance. The Manufacturing Safety Alliance is a not-for-profit health and safety association for manufacturers and food processors here in BC. Our health and safety professionals are here to answer your questions and help you work towards building a health and safety system to the occupational health and safety standard of excellence for manufacturing. Call us anytime for safety training and information, tools, advice, and support for certification. We're always here to help. Today's session in our Make It Safe Expert Series webinar, we take a closer look at the WorkSafeBC Employer Portal and the health and safety training tools and profiles to access and improve your overall health and safety performance and reduce related costs. Today, you're going to learn how to read your employer report card and how to understand the incidents and how they impact your experience ratings, a variable factor that is based on your overall health and safety performance. Throughout the WorkSafeBC Employers Report Card, we will be able to see how our health and safety performance compares against the baseline in your industry. This comparison affects all of our premiums. We'll also learn how WorkSafeBC's claims affect our experience ratings and how together our combined performance within industry can impact our premiums as well. So the actions we take today to keep our people safe can help us reduce our insurance costs in addition to increase safety, productivity, and employee engagement. Today, I have Frank Hamadi, an OHS consultant from WorkSafeBC's Consultation and Education Services Department, and he's here today to show us how to navigate the employer portal, as well as understand the health and safety tools it provides, and how to read the employer's report card and understand what it is actually telling us. I know from firsthand, one of the things that I will do when I'm meeting with employers is really help them understand how to access their report card, how to understand how the information shared there can be read and disseminate what it means, and then ultimately work towards providing an action plan that our safety team can help support them in making a difference in their overall safety management and safety programs. So before starting Frank's current role at WorkSafe, he worked as an occupational health and safety officer for 22 years, conducting workplace inspections and accident investigations in manufacturing, healthcare, and construction. Frank is always eager to share his 30 years of knowledge and experience in occupational hygiene and safety with employers and workers. So I'd like to welcome Frank this afternoon.
Oh, thanks, Wayne. Thanks for the introduction. Good afternoon, everyone. Firstly, I would like to acknowledge that I am privileged to work on the traditional, ancestral, and unceded or treaty territories of the Coast Salish peoples, including the Tsleil-Waututh, Coquitlam, and Kite, and Katzie First Nations. We'll share my screen so we can get started. To make sure I share my sound. And maybe I can get Anna to confirm that I have my screen up.
You're all set, Frank.
Perfect. So again, thank you, Wayne and MSABC for inviting me for this webinar. As Wayne introduced to you, I am an OHS consultant with the Consultation and Education Services Department at WorkSafeBC, and as one of several departments in the Prevention Services Division. And within our division, we have our specialized investigations group that looks into the serious incidents and accidents that happen. Our OHS practice and engineering support. We have our credentialing group as well that looks into certification. And we have our new recent certification around licensing and certification of asbestos, but as well as around first aid and blasting as well. We have our inspection officers that work in the field as occupational safety officers and occupational hygiene officers that do enforcement of the regulations and do the workplace inspections, as well as our risk analysis unit that looks at sort of these potential catastrophic events. And so that's sort of our group as a whole. And our consultation education services group, what we do is we promote safety ownership and encourage a culture of safety through our collaborative initiatives with industry associations, labor organizations, and health and safety associations like MSABC. So we take part in these webinars and attend their safety conferences as well. So that's some of the stuff we do. And so what I'd like to talk to you about today is about the WorkSafeBC Employer Portal and the information that's available. So what I also like to do is talk about how we can use that information to help you as the employer reduce some of your premiums and what that looks like. And so the information that we have is through the Employer Health and Safety Toolkit, the Employer Report Card, and a bunch of other information that we currently have available through that portal. And then at the end of this session, if there's any questions, that we'll have a Q&A session. If there's any questions that you have that I can answer, if there's anything pressing that you want to ask in between, then I'm free to try to answer those questions if you want to ask those. If Wayne wants to interrupt partway through, if you have a pressing question, that's okay too. All right. So maybe just in the chat, if I can just get a response to you as far as how many of you as the employer representative were aware of the employer portal, and if you've made use of the employer portal. I'll keep talking while people try to answer in the portal. I see some yeses, so that's great to hear, because there's lots of information that's currently available. So if you haven't, oh, we have lots to use it often. That's great. So some of it may be nothing new for a lot of you, and hopefully you'll learn some new things that are currently keep getting added and revised. So if you go to our main webpage, worksafebc.com, then you will see that in the top corner that there's a place to log in. For those that aren't aware of it, you can create an account if you don't already know, or maybe in some cases, maybe your accountant is the one that registered the company, and that person might have the login information. So then you would log in and then enter your password. And I have a live test version that I will bring up so you can actively see what that looks like. I'll just enter my name. And if you want, you can copy my email address if you have some questions at some point down the road that you'd like to ask me directly. It's just my first name, frank.hamada@worksafebc.com. So I won't be surprised if I get inundated with questions in the next week or so regarding the portal. So this is essentially what it will look like when it finishes loading. So you get your insurance tab, your account information, your payroll status, etc., etc. The middle sections, your health and safety tab, and thirdly, your claims information if there's claims. So what we're going to talk about is the health and safety center tab here, and we're going to talk about some of the new things that got added really briefly, what we're hoping to get, and it helps everybody on the health and safety prevention side is managing your health and safety contacts. So if you click on that, then we're hoping that employers will actively enter in the health and safety contacts for their company. So that way, so right now, oh, here we go. So there's some sort of generic information. So you can just sort of add your health and safety contact information. You can edit it, add some new ones. So we're hoping that, you know, if employers update it, then we know from the prevention side who are their direct contacts around health and safety issues. So if we go back, takes us back. And so unfortunately, I can't directly demo the health and safety toolkit because there's no data in there. But we'll get back to that in the presentation. So there's the employer incident investigation dashboard. So it'll, again, tell you where you are if you're submitting an incident investigation report, if you're doing a preliminary report or a final report, you can submit this directly into this WorkSafeBC system. So you can start a new one. So if you want to start a new one, you can start up here. If there's one in progress, then you can edit investigation. So here's a lot of different ones that were sort of sampled in the system, in the test system. Okay, so what I want to focus right now is the health and safety toolkit. So we will move forward. So this was a sample in case I couldn't get it up and running. So the ways that by using the employer health and safety toolkit, you will find you can look at the information, and this will help you realize where your insurance premiums are. And if you weren't aware that the premiums that are paid by employers, there's a base rate for the industry group, and there's rate settings, but there's opportunities when you look at your employer health and safety planning toolkit to see where you are, because there could be a surcharge that goes above your base rate, or there could be a discount. So maybe I'll just pose this in the chat again, like, are people aware that there could be a surcharge of up to 100% of their base rate on the premiums, as well as a discount of up to 50% of their base rate? If you could just, okay, so there's some people that are aware. Okay, good. Yeah, so some people are aware, some people may not be aware. So this is just again, a tool to realize that through the toolkit, how much money a company may be assessed on the premiums above their base rate or below. And so this is just another way. And then again, using certificate of recognition is a process where you can look at your a way of getting another way of getting a discount by participating in the core program with MSABC. It's the OC program where you can get up to 10% off your premiums. So if we look at the toolkit, let's move things around for me to view. So here's an example of what, if you pull up the Employer Health and Safety Toolkit, this is an example of just the summary page. And this quickly can show you what your experience rating would look like just on the sidebar here, going from green to red, green, yellow, sort of red and dark red, and how you compare to your peers overall. So this one's sort of not doing great, but not terrible. It's not all the way to the right side. And then it talks about the injury rate, and there's no indicator for a serious injury and not too bad for duration. So in this case, if you look at the financial summary, it tells you like how much of your overall cost of the claims for a particular year, in this case 2022. And in this case, this employer example has a discount of 7% off their base rate. So, and there's a potential savings if they were at maximum at 50% discount, there's a potential for a full discount of $10,000. And it also tells you sort of the accident type is related to overexertion. So again, for those that don't know, again, this sort of health and safety planning toolkit page is the summary. And then at the top here, you can go to the forecaster, another graph that shows you how you compare to your peers, the injury breakdown maps, return to work, industry risks, and some more information. So what you would see in the experience rate forecaster page, oh, sorry, just a sec. Oh, so there is, I just wanted to show you this video before we go to the forecaster page. It's just a quick demo, which I'll have a link at the end of the presentation that will be provided. And it just sort of gives a quick summary of the health and safety toolkit. So I'll just let this run. It's not too long, so I'll just let this run.
You're the business owner or manager of a medium or large company. Or maybe your job is responsibility for health and safety. Whatever the case, you want to know how to create a safer workplace, prevent injuries, and reduce costs. The Employer Health and Safety Planning Toolkit is your one-stop web tool to help you and your company with health and safety planning. It's like a data warehouse of your company's health and safety history at your fingertips. So how does having all that information in one place help you? Well, the tool allows you to see your industry's risks, how your workers are being injured, and how you compare to your competitors. It lets you see which injuries are driving your costs and forecast the money you can save by preventing them. But that's just the beginning. Once you can see where your injuries and hazards are today, you can develop plans for the future. See how these changes could affect your bottom line for the better. And best of all, If you need to present this information to your boss or partner, the tool lays it all out in easy-to-understand charts and reports, making you look pretty smart. The Employer Health and Safety Planning Toolkit. Unlock your data today. Go to WorkSafeBC.com.
Yeah, so when you look at the health and safety planning toolkit, we look at the other next tab. This is the experience rating forecaster. And basically, this is an example from two different screenshots. I just wanted to demonstrate, sort of illustrate the difference. So in this case, you can see on the left graph that this employer, their experience rating over the last early 2020, 21, like they're at a discount. So they're at a discount rate. And this turquoise color indicates a bit of a forecast. So you can see that possibly they may have had a few more injury claims and it sort of start to rise. And then it's just predicting that maybe that was just a blip and then it'll start coming down. On the other hand, if you look at the graph on the right, it illustrates that this employer is not doing very well with respect to their injuries and claims costs because their experience rating is significantly high. So they were at pretty much 100% and still at 90%. So, if they implemented specific health and safety program measures, then they could potentially predict that their forecast their experience rating would drop. So, when it's related to your claims costs and you have a high number of injuries, high number of significant claims that are driving those costs really high, then your experience rating will be in excess, and potentially in this case could be 100% like this employer. But if the company wants to make a change, then there's some information here that can tell you sort of where you should focus on and focus your efforts and to reduce your number of injuries and reduce your claims costs. So with the forecaster, there's different ways to utilize a forecaster. One way is to there's on the side, if you were to increase or decrease your claims cost or keep it the same, then it will help sort of map out on the graph where you will be as a company. And the experience rating is based on a 3-year window, if you didn't know, where the injury claims costs are weighted more heavily on the front end at like 66%, and then drops down to like 33%, and then 15, I forget the numbers now, 50%, 33% and 15%, something like that. And so then, if there's a significant injury on the front end, as the years go by, then the weighting on the experience rating calculation diminishes. So if you can forecast decreases in overall injury costs in the future, then you can see the projected graph and you can show that to senior management to show the impact and reduction and the potential savings you can have on your experience rating costs. One of the other graphs is how you compare to your peers in your group. And so this is a graph of, someone that has the close to 90% experience rating, where they sit with respect to accessible payroll. So there's a few other companies that are quite larger in payroll. And then you can see a cluster that, there's a lot of a lot of firms down here that have a discounted experience rating, and their payroll is significantly smaller than this one in red. And on the next graph on the side, you can see this is just another example of a different company where you can see it's a very large company and they're at a discount, and you can see the cluster of other firms that range from discount. Looks like a lot of these firms are at a discount, and some of them are at a surcharge, and they're all kind of clustered in the same sort of payroll size. So if you, this is a screenshot from the employer report card, which is for your own individual firm. And I'll pull up a sample of what one looks like, but this is just, again, to illustrate your experience rating for your company, potentially, if you're sort of in excess. So it's looks pretty stable. And then there's a bit of a rise in 2017. And then you can see, again, graphically, what that means relative to your base rate and what your net rate is as a surcharge. So you can see their base rate is hovering close to $1, and then their surcharge. And then you can see what it is from a dollar amount. And then the next slide will show you the actual dollars that you're paying. So in this case, this company was paying a surcharge of close to $100,000 in 2015, $150,000, back down to $100,000, $136,000. So, you know, for any company, you know, again, for this payroll size is $40 million. It's quite large. But, you know, relatively speaking, for any employer, if they're able to save money, I think that's a good thing, and put it back into the company and put it back into, you know, new equipment, training. You know, in this case, there's a potential maximum savings in around $300,000 per year if they get maximum discount. And conversely, on the maximum surcharge side, if they had a 100% surcharge, they'd be upwards of $750,000 surcharge, right? So nobody wants to, I'm sure, pay the extra money if they don't need to. So these are opportunities for companies to take a look at these numbers through the employer report card and through the health and safety toolkit. Is just another tool to sort of bring to, you know, senior management ways to save money on your premiums, and how important it is to look at health and safety in the workplace. So if you look at the injury breakdown map, again, this will help you determine sort of where all the injuries are coming by the nature of injuries. So you can see there's like, the mapping shows that overexertion is the largest one, and exposure to toxic substances, repetitive motion, struck bys. So it looks at different categories, and you know, you can change them and look at the source of injury instead of by the different accident types. You can source of injuries, whether it's structures, land vehicles, hand tools. So this, again, you can look at by the breakdown map by cost. So again, overexertion is the most costly out of the group. Repetitive motion, falls from elevation, struck against, falls on the same level. So they start to get, by the different types of the cost, are getting very close to the same in the categories, but you may want to focus obviously on sort of like the high cost items. So this will just help you put your information into action. This helps you to provide information and should be shared with your joint occupational health and safety committee members. Gives them the tools to provide some focus, try to identify which injuries occur the most in your workplace. Are there quick fixes? Are there injury types that can be addressed or eliminated with simple safety improvement changes? So it provides some focus for your health and safety committee as well. And this information should be shared for everyone to use. So this I will pull up. Oops. I was trying to zoom in so everyone can see. Scroll to the top. So this is an sample that's on our website of an employer report card, and it'll be provided in the link of information at the end of the presentation. So again, this, for example, this firm is at a 41%, 42% experience rating. So they're not doing very well against their peers. Their injury rate, they're ranked 140 out of 185. Again, not that great. On the plus side, their serious injuries is doing pretty good. They're 11 out of 85. Duration is kind of in the middle. So then and here, this page basically will tell you your number of time loss claims from over this period of time. And I'll just sort of scroll down to some of the other information that we talked about. So here's the experience rating information. They were at a 30%, have fluctuated, still around 30 and then up to 40. And again, it tells you what your assessable payroll was, and then your assessment amount. And again, this is sort of where I got this screenshot from, and it tells you sort of, again, your experience rating and your trend. So this is very visual for everyone to see. And again, highlighting your experience rating and your surcharge and what you would pay at base rate, and then what the net rate is. And then on the next page, it'll actually tell you what the dollar amount is. So again, this company has had a surcharge at around $100,000, and then went up to 150, 100, 136. So again, the information that's provided in an employer report card is extremely useful to provide the information for you to you and your health and safety committee members to sort of provide some focus on how you want to set your goals around health and safety in your workplace and the opportunities for injury reduction, injury management, and in turn potentially help reduce your premiums through the reduction in your claims cost. And as well, like with that and a good return to work program, all this will help with the reduction in your claims costs. So again, just to reiterate, how is your organization doing? Do you know? Do you have a good idea of what's happening with the types of injuries, the injury claims costs, where they're happening? So if you don't, then by looking into the health and safety toolkit and looking at the information, looking at the data, using the information on the employer report card, all this information is available to you. It's readily available, You can see how you compare to your peers. You can look at your inspectional history. You know, again, discover what you can do to improve by looking at that map, using the forecasting tools to project what can happen if you put some effort into managing those injuries, looking at the risks of injuries at your workplace. You know, you can develop and implement your health and safety action plan. You know, learn what regulations apply, what are the most risks that are cited in your industry. See your return to work trends. If you don't have a return to work program, you know, you can contact WorkSafeBC and someone can help you develop that. Some of the things that we talk about regarding return to work is sort of stay at work. You know, how do you manage injuries at work through your first aid, attendance, the ability for workers to stay at work before they go off on what potentially might be a serious injury, and then a return to work program. It's important to learn about your high duration claims costs. So, you know, you learn about your high duration claims. Like I said, look at these charts, and then you can, it's kind of a full circle, like a health and safety management system. You look at your organization, create a plan, what you can do, implement your plan, and then come back and evaluate your plan. So it's like the plan, do, check, act process, like you would in a health and safety management system. So, and then once you evaluate your plan, you see what your progress is, and you do your evaluation, and then you just make adjustments as needed. You know, the other resources that were on the website, on the planning toolkit. I'll just go back to that. What you can see is we had already looked at the employer incident investigation report. The hearing loss system, I believe. Would provide you with information about workers that had hearing testing. So, and you can look at that information to sort of determine which workers are starting to develop significant noise-induced hearing loss. And if you already know that your workplace has a lot of noise, then obviously, you know, you should be looking at the hierarchy of controls if there's ways to reduce noise in the workplace. But this will just provide you with additional information to show that that there may be other workers that have some hearing loss issues. My health and safety resources is a bit of a newer application, and this sort of is intended to sort of curate the available health and safety resources that we currently have on our website, because there's a lot of information on our website, and I'm sure a lot of you have already gone on the website and sometimes find it difficult to find information, as we all do. So this is just sort of one way to curate that information. So you can, I'll just type my name as the name of the report, and they just want your role. You can say health and safety personnel or employer. If you're a larger employer with 50 more workers, I'll just say I have 60 workers and less than 20 minutes. How many workers do I have on a shift? Let's say it's the same, 60. And They want a classification unit. Let's say, what are we? Let's say with sheet metal fabrication. And so it gives us some information on hazard rating. Oh, so it says my hazard rating would be a medium. And this is kind of an odd one, but we're manufacturing because we're sheet metal. Metal fabrication is what we'll tick off. And then we tick off some of the information that we're looking for, like de-energization lockout, general PPE, maybe just general ladders, and obviously we want some information on safeguarding. Maybe we have some overhead cranes. Maybe we have a gantry crane at our work site. We do some welding. We have some WMIS issues. Yes, it's noisy. And yeah, maybe we have some metalworking fluids. And there may be some other issues other topic issues that you might want to select down here as well. Maybe slip, trips, and falls. And then select next. Common injuries. You may want to select Voltex, sprains and strains. This one I find kind of odd that they kind of throw in here. They may not always apply, so we'll just continue on and then get my report. So here it just sort of summarizes sort of the general requirements for a workplace. And then here it talks about specific topic areas. And it just will curate all that information. Unfortunately, on this demo environment, I can't show you what the report looks like, but basically you can download a report and download it into a PDF or an Excel spreadsheet. So I'm not sure how many people have used that, but it basically, like I said, curates all the information that's currently available on our website to make it a little bit easier to find, because some people may find it a little bit challenging to find the information. So, and then the other other links that we have is how to submit a Form 7. Oh, that one's not working. How are we doing for time, Wayne? Or Anna?
We're still doing good, Frank. So you're good to go for a few more minutes before
Okay.
question answers.
Perfect, thank you. If you have a notice of project, you can submit a notice of project for a construction hazardous materials. That's available. And if you've had an recent inspection by a prevention field services officer, then you can look at the inspection report. And I think in what they're trying to additionally do with this application is eventually, if you were to comply with the orders, any outstanding orders, that you'd be able to submit information through this portal as well. Eventually, that is the plan. So that was I know it's probably a lot of information, but again, like through our, as a business, everybody wants to be able to sort of save money, reduce spending, and be more profitable. Being knowledgeable about the different parts of the business is important, whether you're the owner, the accountant, operations manager, health and safety professional, knowing where the money is being spent, where it's going, are ways that you can save money, knowing where it's being spent, and if there's ways you can save money. And again, having a robust health and safety program from a prevention standpoint, I believe is a key element in a company's core value. And in turn, it can save you money anywhere up to a 50% discount on your premiums off the base rate. And even more if your starting point is already at a surcharge. So, I think, knowing that, this is available for those that it may be new for some of you, and it looks like there was a lot of you that do already make use of the employer health and safety planning toolkit, and we're aware of it. It's a good starting point around developing a good health and safety program, providing some focus on where you can focus your energies on where injuries are happening, and where you can sort of reduce those claims costs, figure out ways to manage your claims. So I encourage those that haven't made use of it to for sure hop on and take a look. And if you have any questions, by all means, feel free to contact me or anyone over at MSABC to help you out if you have any questions.
Frank, thank you very much for taking us through the employer portal and helping us decode the information available that's there for employers. I know that for ourselves, with our strategy with members around high ER, so high experience rating reduction, it really centers around the review of the report card and really becoming familiar with the various touch points within it, the data that's there. And then with that, we're using this to formulate our annual action plans to help employers set a framework for key areas for them to work on with us and their team to reduce injuries and ultimately, get control of claims costs. So this is a great opportunity here to just really play around with it, get involved, and really understand how this tool can work to support your decision making going forward. And it really tells you where you are on your baseline. So again, thanks for sharing that with us, Frank. And so we're going to move into some Q&A. And reminder to our audience, if you have any questions for Frank, please submit through the Q&A icon, and we'll address as many of those before our time is up. And so I do have a couple questions right off that have been forwarded to me. One attendee today says that they do not have an option to add health and safety worker information on their own portal. What can they do, and who do they talk to get that function?
Oh, you can contact me and contact me directly, and then I will find out who the specific person on that end will be for you. So I can be sort of your conduit.
Perfect.
I can do that for you.
And again, our team will make sure that Frank's email address, I think I saw it in the chat already, is there and available for you. So you can reach Frank directly with any specific questions. Another question for you, Frank, is the growth in personnel in a 3-year window, is that taken into account into the forecast? So if you have an organization that's growing, would that be taken into consideration?
So what you can do in the forecaster is I had demonstrated in the window that you can go like 10, 20, 30% increase or decrease, but there's also a manual option is in there as well. So if you're forecasting a significant rise in payroll, you can change the payroll information manually, and you can also do your predictions on claim costs manually in there as well.
Okay, great.
Yeah. So right now, I was looking at some other data, and I guess because we're the time frame, if you go in there now and look at your forecast, your general forecasting for yourselves, it may look kind of a little wonky, just because I went in to look at some other data from other employers, and I was told because we're in a rate setting period right now that there's some weird fluctuations in what it looks like. So if it looks kind of weird right now, I would say wait a few more weeks and go back in to look at your own data, and hopefully it's sort of more level and more accurate. But right now it just seems to be out of touch. When I was just trying to, as you saw from my graphs, there was one that had a big drop. So I was just trying to find ones that were more normalized, but they all seem to be kind of weird at this point in time. Weird at this time of the month, I guess. So if you can be patient and wait and try again.
All right, perfect. I think this has already been answered, but we'll ask it again live. Is the 5% rebate for having a return to work program going to be reinstated in the future? We'll hold you to the record on this, Frank.
There was a pause on that. I'm not even sure how long ago. It's been several years now since there was a pause. For those that don't know, there was 5% rebate for a return to work program, and then 10% for the core program, certificate of recognition program. There was a pause on that for the return to work, and I can't make a commitment. I have no idea where that's, if it will be reinstated or not.
Gotcha.
So I don't know is my answer.
All right. We'll circle back with you again. Another question here. What are the largest factors in increasing WorkSafeBC's premiums?
Well, the major factor is your own individual claims costs. And like I said, it's based on a 3-year window, but there's also some factors involved with your rate group. So it gets a little bit complex. So you can go onto our website. I'm not the guru on the premiums and rate setting, but we just had a rate setting information session, I think the last one just a couple of weeks ago. But for the most part, it's related to your own individual claims costs for the company. And like I said, it's based on a 3-year weighted window. So on the front end, so currently we're in 2023. And so your premiums would be impacted going forward, I guess your 2025 experience rating would be impacted by 2023, like by the time they get like the final claims cost for that year, and then it impacts like a year, a little bit ahead. So if you had major injuries this year, it would be you would see an increase impact that would happen in 2025 experience rating.
Yeah. And I want to add that, again, in joint health and safety committees, when you're starting to look at incidences and you're starting to track, those injuries and incidents, also tracking your your near misses is also an indicator potentially of risk. And so I just want to encourage you to, be looking kind of at some of the trending that's happening in your joint health and safety committee, because again, you're looking at your report card, you're looking at incidents and incident reduction, as well as claims cost reduction. Again, looking at some of those near misses can also be helpful in triggering action towards reduction of injuries and incidents.
Absolutely. And again, like looking at data in manufacturing, we know that a large number of the claims costs are related to overexertion, MSI related injuries, and that continues to be a focus for WorkSafeBC from Prevention Field Services when they do their inspections, as far as, our employers assessing the risk for MSI type injuries. It can be challenging, but again, nobody wants to be injured. Everyone wants to be productive in their work life and their home life. So we, as an employer, it's important to make sure we have everyone on board and look at those risks of injuries from MSI to other serious injuries.
Yes, yeah. And one of the things that we're seeing more of our members engaging with us, we have a full-time ergonomist on staff where we're going and doing a lot more assessments on site because of those repetitive motion injuries, and looking at how we can create preventative measures to support workers and reduction of injuries. So again, encourage those folks that think that they want to do some preventative work, reach out to the Alliance, and we probably could help and support in that area. One last question for you, Frank, as we come to a close here. When a company receives relief of costs, it reduces the impact to their experience rating, but does the overall cost of the claim still impact the base rate for the classification unit?
That I'm not exactly sure. I don't want to say something out of turn, so I don't know that part of the...
Is that something we can come back to you on?
Yeah, you can send me the question. I can look into it a bit more.
Sure. Great. Well, again, thank you, Frank, for joining us today and giving us a lot of insight to the Employers Portal and the Employers Report Card. To everyone in the audience, thank you for sharing your questions. If we didn't get to your questions today, we'll do our very best to respond to them and get back to you through a follow-up. Any unanswered questions that come in, Frank will hopefully answer later. We're going to give a copy to Frank, and we'll share those answers on our website for everyone to view. WorkSafeBC is also the safety sponsor for Make It Safe Vancouver coming up October 13th. And of course, our Make It Safe online October 26th and 27th. So just about a month away here before we roll into Make It Safe fall, and we're really looking forward to seeing you all there. So before we close, some quick reminders about some additional events that are coming up this month and next. Work Wellness at Work workshop, which is actually happening just this week, Thursday. We still have a few seats available for this workshop on mental health wellness at work with Dr. Steve Conway, our mental health director here at the Alliance, this Thursday in Langley. Please check out our website and register for that workshop coming up this Thursday, as well as our Make It Safe Expert Series workshops. We're going to be in Prince George next week. I myself, along with a number of our colleagues, will be in Northern BC. Sign up today if there's any Northern members here or independent members here. Please sign up for our workshop in Prince George, which will take place on September 27th, and a full day of joint health and safety training with one of our advisors on the 28th at one of our member wineries. Learn more through our website and the links within the chat, and sign up for our workshop, our first workshop and training session in Prince George next week. As well, I want to mention on October 4th, our allied partner TextMed Services Inc. is doing an educational open house and networking opportunity at their headquarters, their brand new headquarters in Chilliwack. So come learn more about disability management, return to work, and make new connections and win some potential prizes. We're really excited about the work that TextMed is doing for our members in support of return to work and disability management. So we encourage you to check out the website and look for tickets for that open event on October 4th. And of course, get your tickets now for Make It Safe Vancouver online. The early bird deadline for this event is Friday this week. So hurry for the best rates. Make sure you secure your tickets. The live event will sell out. We are seeing our tickets really picking up. And so this year's live event will sell out. And we do also have our online event the 26th and 27th of October, which will showcase expert series and other joint health and safety related training for everyone in your organization. We encourage you to check out our website for ticket information and sign up very soon. So again, visit us online anytime for help or access to our full library of webinars, resources, and training. Watch for an email tomorrow with a link to the recording of today's session and a survey, obviously, to share your feedback and topic ideas. We'd love to hear from you on things that are important to you in safety. So please reach out to us. Let us know what's important to you, and so we can bring that at an upcoming webinar or a topic at our Make It Safe Expert Series events. So thank you again for attending today. We hope you have a wonderful and safe day. Thank you, and we'll see you next time.